Hi, this is Dr. Sarfaraz, and I want to share some piece of advice for the students of first year health professionals. MHS exams are going on, and most of the students have asked me queries via messages. So, I would like to answer. Let us start with the theory paper. So, as per MHS guidelines, theory paper is each of 100 marks, paper 1 and paper 2. Oral or Viva voice is total of 200 marks, out of which spotting is of 20 marks. As you all know, uh, MCQ, SAQ, and LAQ is the pattern of the theory paper. So, as far as the MCQs are concerned, uh, I personally feel each and every student of the batch, of the whole strength of the batch, should score at least 19 and at most 20 in the MCQ. The reason is that is the scoring point. Once you get all the 20 marks in your hand, out of remaining 80 marks, you have to score just 30 for passing, which is not a big deal. I'm not promoting you just for the passing. I am just advising you the minimum weightage you can score. For medical field, scoring is most important. So when SAQs are concerned, SAQ is of 40 marks. 8 SAQs with each carrying 5 marks. And 4 LAQs with each carrying 10 marks. That is how the total becomes 100. 20 marks MCQ, 40 marks SAQ, 40 marks LAQ. The most important term and condition and the thing of MUHS paper is this all are compulsory. Nothing is for option like other streams. And once you start living the formatives like objectives and SAQs and LAQs without attempting them, that is the biggest fault you do while giving the theory exams. The biggest problem you will have to score and also to reach up to the 50 marks. The reason is uh, once, for example, you could not attempt a SAQ, means you are leaving 5 marks, and suppose you leave a LAQ, then you are leaving 10 marks, and each and every mark in the theory and practical is most important. As I said, in MCQ you should have out of the score, that is 20. SAQ, most of the students do have the answers what has been asked in the exam, but they still don't come to the exact expectation from or out of that question. For example, if stomach bed is being asked, most of the student write the stomach bed in the end, but previously they start writing everything about the stomach they know, like external features, subdivisions, which is not required. Let us talk about, for example, for instance, posterior relations of liver. If only posterior relations are being asked, students should not make a mistake of writing everything about liver they know. This is only I'm talking about SAQ. As far as LAQs are being concerned or discussed here, for LAQ you have to write everything unless and until sub questions are asked. For example, month-wise development of fetus is being asked. You have to write, you have to define what is Garbha, Garbha Sharir, and month-wise, that is Masana Masi Garbhuddhi, if Ayurvedic and along with modern is asked. Now let us talk about my syllabus. For example, uh, eyeball is being asked as a sense organ for LAQ. At that time, you should write each and everything whatever is being taught by me in the class and given notes about the eyeball, Ayurvedic part, and in modern part, specifically the three concentric codes. Each concentric code you should explain. For example, outer fibrous has sclera cornea, middle vascular has uveal tract, that is choroid ciliary body iris, and inner nervous cord, that is retina. But you should not stop here. Again, you have to add aqueous humor, you have to add lens, vitreous body, muscles of eyeball, blood supply, nerve supply, everything, histology, and lastly, applied aspect. This was example of um, sense organs. Let us talk about thyroid gland. In thyroid gland also, basically you should start from the endocrinology, the basic structure of thyroid gland with two lobes and the isthmus, their relations obviously. You should also write the secretions, and accordingly you should also write the applied aspect of it along with the histology. So LAQ demands everything about the anatomy if there are no sub questions. For example, if some paper asks the LAQ like describe the muscles of the forearm, at that time there is no limit. You have to write the extensor group of muscles and flexor group of muscles also. But such a question has never been asked yet. I don't know in future. Whenever SAQ is concerned, what SAQ demands, the question demands, you should write concise and precise only what has been asked, not extra other things you should add. For example, difference between right and left lung is asked. You should write every single difference between the right and left lung, including the root, the mediastinal relations, and everything. But when a question like cecum is asked for SAQ for 5 marks, you should write everything about cecum. But when positions of appendix is asked, you should not write all the anatomy of the appendix. Only positions are asked, you should write positions. When subdivisions of stomach are asked, you should write the subdivisions. When body of pancreas is asked, don't write head, neck, tail just because you know it. Kindly remember all these guidelines. I hope you will have the, not, I would not say you will have the required score. I would say you will pass with the flying colors and wonderful marks in the forthcoming exams if you keep in mind these all things. Last but not least, time management is most important. Whenever we have term end exams and periodic assessments, we come to know students find or they lack a much to explore in the theory papers and test papers because they have lack of time. So have some time management. Accordingly, arrange everything. First MCQs paper is given and taken. So the remaining 2.5 hours are only for SAQ and LAQ. Remember, you should cover the paper. You should cover each and every questions, as all questions are compulsory. You have no any options. And most importantly, write everything you know, but for SAQ what is required, write that. And for LAQ, everything you have to write. I hope these guidelines are much important in the framework of giving MUHS theory exams. I wish all the best for all my students who has coaching under me, and I hope they will pass with flying colors. Not only pass with flying colors but get good marks. All the best.